I'm an ER doctor and I don't have health insurance, and here's why. Health insurance is a scam. Am I telling you things you already knew? Keep watching. Did you know that the cost of labs and most imaging is actually inflated when you use health insurance? In other words, you pay a premium, a very large premium, or your employer does, and the copays that you get for your labs and your imaging when ordered may actually be much higher than the cash prices for the same labs. In other words, you are paying a premium for the right to pay more than the services are worth. How do they get away with this, and how can you fight back? Follow for more tips and tricks on how to hack your healthcare from an ER doctor.
I'm not going to buy health insurance anymore. I'm not doing it. If I catch something and I can't afford to pay out of pocket to fix it, I'm just going to let it kill me. It's not worth it to me. It's not worth it. I'm not going to keep extending my time here just to keep feeding the machine. Just so another CEO of Insurance RS can buy another $200,000 car. We're all going to die eventually. Fuck it. Less money in their pockets, I say.
American health insurance, why do you routinely suck? Tell me why I ordered all of my wound care supplies for a patient, and one of the most important things that the doctor ordered, they don't send. And they're like, oh yeah, it's not covered. Sorry. And I'm like, okay, can I order it for my car supply? And they're like, oh yeah, sure. Why?
Americans are over with health insurance. I really believe that health insurance is like the biggest money trap in the world, not just America, because it takes so much of your money, you know? Even though you're not that sick, even though you're not dying, you have to pay so much money just to get a little treatment. You know, it's too much. It's too much. But if you're trying to get a job, a good paying job, get into health insurance, because definitely it has a lot of money in health insurance. You know, it will never die out because people are always getting sick, and there's a lot of loopholes that these masterminds can play around with this health insurance system. That's why they make so much money, because copay, premium, and stuff like that, they change it every year. There's so much things that they can play around to make money, and us Americans, us people, we just fall into the trap. So I don't know, man. It's just too much.
Okay, so last week I was gonna get surgery on my thumb. I have this lump on my thumb that I've had since like October, and I wanted to get it removed. And I went to the doctor and he said, you have 3 choices. Either surgery, poke it with a needle, or you can just like whack it with something. So I was like, okay, I'll probably get the surgery. And he's like, okay, it's like an hour, you're inpatient, it's quick, it'll be fine, and it probably won't come back. So that's the plus side to the surgeries. Okay, great. So they said people will call me from billing and tell me how much it's gonna be. So I get a phone call a few days before the surgery, and they said, okay, you're gonna get a call from the surgeon, the facility, and the actual doctor, the doctor's office. So first the actual surgeon calls me, and when they call, they tell me that it is going to be $600 for the surgeon. $600. So I'm like, that's a lot, but okay. I thought it would be, you know, in the hundreds. And then I'm thinking, well, the facility's probably like another 100, you know, it's gonna add up. But get a phone call a half an hour later from the actual facility saying their charge is $450. So now you're talking over $1,000 just to be inpatient, when the doctor said I could literally hit it with a book instead. What has our healthcare system come to, where we're paying every single month? My husband pays every single month, and I can't even get an inpatient surgery for this to be removed or checked out without costing $1,000. That is only 2 out of the 3 parties that were gonna call me. And by the second call, I just said, forget it. I don't want the surgery, okay? I am just canceling it, because I literally was told that I can just do it myself. So instead of going the medical route and getting it removed, I guess I just have to hit it with a damn book. I'm just annoyed. I don't understand. I don't understand. I'm at a loss for words, which doesn't happen often. So you see me walking around with this thing on my thumb? No, you didn't. We're doing just fine. Leave us alone.
Y'all, if it's not one thing, it's another. I just got a call from the pediatric dentist that is going to do my 5-year-old's capping on his teeth. He's got some dental issues here in the front and we need to put caps on them. So we've been on a waiting list to get that done. They called today to try to set up something. And I asked, how much this is going to cost. We have dental insurance. But my insurance does not cover anesthesia, number one. Who is out here getting dental procedures or any procedures medically done without anesthesia? Why wouldn't you cover anesthesia, especially for a child? Like, I don't understand that. So for 40 minutes of anesthesia, they want $900. 40 minutes. And that doesn't even include the price of the actual procedure, which is $600. So $1,500 to get this done. And that's out of pocket. So I was like, okay, well, is there any way we can do a payment plan? I can make a deposit and then do a payment plan. No. It is $1,500 due up front before the procedure. So, I mean, honestly, like, in this economy, who has an extra $1,500 laying around? Because I don't. I mean, a lot of times we are paycheck to paycheck. And that's just the sad reality of the times that we're living in. And I just don't know what I'm going to do. Like, it's so frustrating. Like, he needs this procedure done, but I don't know, y'all. Our healthcare system is just a freaking joke. Like, what's the point of even having insurance at this point? Like, if they're not going to pay for anything. I mean, they won't pay for the anesthesia. Like, that part gets me the most. Like, that might be able to get reimbursed some on the procedure, but I don't have the money up front to do it. So, like, I'm going to have to probably take out some sort of loan or a credit card to just be able to do this. Like, it's just absolutely ridiculous, and I'm just done with it. I'm over it.
I'm so annoyed right now. I just called the imaging place in Missoula because I have a little lump I can feel like right here, and I want to get it checked out. And I don't want to go to the doctor and get a referral and do all this bullshit. I just want to go to the place that's going to image it so they can take a look at it and do an MRI or a sonogram, whatever the hell they're going to do. And unfortunately, I just called the ear, nose, and throat place, and they're like, no, you can go get a referral from this person, then go to this person, and then you can come to us and we can image it. And I was like, well, I don't have insurance. I just want to pay cash. Can I just come in and get an image of my face? Can you use your image machine and look at my face and give me what you've come up with by looking at those images? I just want to know what that costs me out of pocket. No, sir, you'll have to go to another person that's going to charge you ridiculous amounts of money for 10 seconds of their time to refer you over to here so we can charge you ridiculous amounts of money for 20 seconds of our time. Now, to be clear, I don't have medical insurance because I make too much money to qualify for Medicaid or free medical insurance. And every time I try and get medical insurance, they want me to come out of pocket some astronomical amount to pay for tests and all kinds of things to make sure I'm a good candidate for their medical insurance. It is fucking ridiculous. Insurance is a scam. The healthcare system in America is so beyond fucked up. I hate it here sometimes. I really can't stand it. Okay, I don't hate America. I calmed down a little bit. I love America. I just hate the healthcare system. All right, that's it. Have a good day.
Can somebody please explain to me how health insurance companies even work? Because I think that we had a little bit of a communication issue. If I'm paying $400 a month for health insurance, why does health insurance get to pick and choose what they cover? Or if I'm paying $400 a month for health insurance, why is an ER visit copay $500 just for walking in the door? What am I paying for? This is a genuine question. I do not understand this at all. But if I'm paying $5,000 a year, why do I still have to pay at every single doctor's appointment? For most of my prescription medications, I still have a copay. Any ER visit, any ambulance trip, like what am I paying for? I just still have to pay every time. But people who are unemployed and don't have insurance can get like 100% financial assistance. But I just know the second that I would cancel my insurance, I would have something crazy happen that would cause a $100,000 ER bill. It is just so frustrating, and the government just does not advocate for its citizens at all anymore. Like, our country has been so doomed these past 4 years. Something's gotta change, baby.
I remember when I had an ingrown toenail and we had to go to the doctor, and it was a family doctor, and I needed my toenail to be removed. So, took it out, hammered it, did all kinds of scary operation, and my nail was removed. But like after a couple months, it went back. My ingrown toenail went back. And so I went to the actual foot doctor. I don't know what it's called, but it's a foot doctor, and it finally got fixed. But on the very first doctor that we went to, we paid so much money. We had insurance, but we paid so much money. Like, why? And my ingrown toenail wasn't fixed. I should have just went to a nail salon, and just have the Chinese lady just take out my nail. Probably would have been better. But it took so much money, and just operation, and just step-by-step procedure that you have to go to, wait in the office, and blah, blah, blah. It was too much, man. I should have just went to the nail salon, had that Chinese lady just take out my nail. Would have been better.
Super upset this morning, and I just need to know if I'm the one that made the mistake, if I chose the wrong thing, if I did the wrong thing, or if we're all going through this together. I'm a full-time registered nurse, and when I was offered insurance through my employer, I took the most expensive one because I thought if I pay more, it has to be better. I pay $160 every 2 weeks for this insurance. I actually feel sick right now. I'm very just tired, dizzy. I just want some lab work done. Maybe check my thyroid. Like, something feels off, and I want to see a doctor, and I want lab work, and I want to know if there's something wrong with me. So I started calling different clinics. First off, almost nobody will take you. Nobody's taking new patients. I finally found one that is taking new patients on a weekly basis, so I have to call back on Monday. They were going to check if my insurance will cover the visit. I give them my insurance information, and they tell me, oh, you have a deductible of $4,000. So just for you to see the doctor, your first visit is going to be around $120, $140. That does not include lab work. That does not include medications if I need any. If I need a follow-up, it's going to be another $120. I'm like, how? I'm paying like $320 every month just to have this insurance. Just for when I actually have to use it, I still have to pay more. It's not even a specialist, guys. It's the regular primary care physician. I know that I'm very blessed with this, but my brother lives in Monterrey. So I called him this morning, and I told him that I'm going to have to go to Monterrey to be seen over there. And I know that not all of us have that privilege to be able to go to another country to get checked by a doctor, where it's way more affordable in dollars, right? So I'm going to have to travel outside of the United States just to be able to be seen by a doctor. Someone that pays her insurance, and someone that pays a shit ton of taxes in every freaking paycheck. Like, y'all, give me a break.
How can I help you? So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that started 2024, AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentive straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir. You should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
So this year, 2025, and next year, 2026, a lot of the 2000s babies are going to be getting kicked off their parents' health insurance, and they have to go out and get their own insurance plan, whether it's through their job or they're going to go through like a private insurance company. And I have seen so many videos. People are freaking the fuck out at the premium pricing of healthcare insurance. You could be paying upwards of like $700 a month for healthcare insurance. So I wanted to give my 2 cents on this. I'm 27 years old. The day that I got booted off my dad's health insurance, I have never once paid $1 for health insurance, okay? And I think health insurance in this country is an absolute fucking scam, especially if you don't have like an autoimmune disorder, underlying illnesses, any genetic disorders or anything like that. If you are a healthy fucking individual and you are paying $500-600 monthly premiums for healthcare insurance and you never fucking use it, it is an absolute fucking scam. I have talked to so many people in their 30s and their 40s and their 50s, some of which have had insurance their entire lives, some of which still to this day do not. I would much rather, after doing my own research, so I always say do your own fucking research, pay out of pocket, pay cash pricing to go like once a year to see a doctor, to get my blood drawn, to get my physical, then I would by paying $600, $700, $800 premiums a month for absolutely fucking nothing. And the main reason that I say it's a scam is that you could have insurance. You could be paying $500 a month for your insurance plan, right? You could still go to the doctor and you would still owe money. You would still have to pay a copay. You would still have a deductible that you have to pay. It is an absolute fucking scam. Yes, in the one-off that there is some insane accident that may, God forbid, occur. Maybe you get in a car accident, maybe something happens, whatever the case may be, and you need to go to the ER, whatever, they are going to bill you up the fucking ass, and you're going to have to say, like, I don't have insurance, so they're going to have to bill you the cash price. What's crazy to me is that people have done research, and it has been proven that if you call your insurance company and you ask for cash pricing versus insurance pricing, cash is often cheaper. So I would much rather save my $500, $600, $700 per month in my bank account, put that into like a high yield savings account, and God forbid if something were to happen and I do have to pay cash, I have the money ready to go. But you will never catch me motherfucking dead paying someone $500 a month for what, and I don't even use it. The only time I have ever even thought about like, should I get health insurance is for the fact of having a child one day. I want to be a mother one day, God willing. I want to have multiple children, and I know that having a child in this country is literally on average like $100,000 if you don't have good health insurance. But you know, I will reach that bridge when I get there, and hopefully my husband has great insurance and I'll just be on his. But anyways, if you happen to see this video and you're freaking the fuck out, you know, I feel like we are brainwashed into the cycle that, you know, you get off your parents' health insurance, you get into corporate America, you have to pay up the ass for basically every aspect of life. And I just think it is the biggest absolute fucking scam. One of the biggest scams in this country is health insurance. And the thing is, like, let's say you do pay the $500 premium per month. If you don't go into a doctor's office, you are not getting that money back. You just paid $500 for nothing in case of an emergency. It's like car insurance. Like, we all pay car insurance every single month, right? Let's say nothing happens throughout the entire year. No accidents, no speeding tickets, nothing. You don't get back your money. You just wasted all that money just to be insured in the off case that something happens. No. So yeah, I will not be falling into that system. My mom disagrees with me all the time because, again, very like, you know, old school mentality, like, you need health insurance. No, I don't. Absolutely the fuck not. If I want to go and get a physical, I have done my own research. If I want to go get a blood draw, whatever, it's like $200 cash. That's all that it is. You walk in, you get your blood drawn, they give you your labs, looks good, move on to the next. I want to add one other thing. I live in the state of Florida where you can be added onto your significant other's insurance plan as a domestic partner. I don't know if this applies everywhere in the US, but it does in Florida. So my boyfriend works in the medical aesthetics industry. He has insurance. The company covers the majority of the cost. I think his copay is like maybe $80 every 2 weeks. And so when I found out that I could be added, I was like, you know what, just for shits and giggles, let's see how much it would be to add me. So we went through the entire process and he added me on as a domestic partner. And before we submitted any of the documentation, his insurance went from like $80 for himself to being like $480. So that is what it would cost to add me per month just to simply exist on his insurance plan without having any underlying health conditions, without having any autoimmune disorders, just being a healthy 27-year-old individual just to be added on. That's what it would cost. He still pays copays every single time he goes to the doctor. He does have a high deductible. I believe it's like $2,000. It's just an insane concept to me. Now, when you get married, it does change a little bit, so I don't think it would be as much if we were married and I did get added onto his health insurance. But anyways, save your fucking money, put it into a high yield savings account. If anything were, God forbid, to happen, you have the money on hand to pay for it in cash.
When I turned 26, I'm 28 now, I got removed from my parents' insurance. And ever since, I've never really get into health insurance because I knew from the beginning it's a scam. You know, I just knew that health insurance is just, it's, if you're not dying, if you don't have like a illness that is life-threatening, don't get health insurance. You know, you don't need it. You don't need to be paying like monthly $1,000 a month. You know how much expensive it is to be paying $1,000 per month? That's too much, you know, for an average person, especially living in this economy where things are always down, the money, people are living paycheck to paycheck. It's hard, man. Like if you're a normal average being person with a regular lifestyle, you don't have a life-threatening disease, don't get into health insurance because it's just gonna drain you. It's just gonna drain your pocket and your life. You're basically just paying your income that you're getting, you're paying like 30% of it just for the health insurance. And if you're not getting sick, why? You know, why?
So today is the first day ever, at least that I know of, that I don't have health insurance. I am 26. Before anyone gets all crazy, I was on Medi-Cal. I work part-time for the county, but apparently I make too much to qualify for Medi-Cal. And as a part-timer, I don't qualify for benefits. Make that make sense. What am I supposed to do? The system is fucked up.
Health insurance is such a scam. I tore my ACL at the end of 2024, had surgery, struggled to fully recover, messed up my meniscus. I've been in PT ever since. I work for a corporate company. My health insurance changed at the end of last year, and so now it's going to be everything's out of pocket until I hit my deductible. I asked my PT place how much a session costs out of pocket. They told me $123 flat. I thought that that's how much I would be billed. Turns out, for people paying with insurance, it's like quadruple. So I could have no insurance, go there and pay $123 flat, which already, yes, that's expensive. Or I could go with insurance and I'm billed $481 for 1 hour of physical therapy. What do I even have insurance for? I'm so pissed off. And now I'm just like at this place where I'm like, am I ever gonna be able to like recover and play sports again? Like I love being active and I'm not in a place where I feel comfortable to move my body in the way that I used to be able to move. And I know that that happens with age, but like, I'm not that old. I want to recover. I have a long time with this knee, and this fucking health insurance in this company, in this country, is a scam. Sorry to get on this app and just yell, but like, I could cry right now. I could cry. It's too much. I swear I am fleeing to another country, but they're probably gonna hate me there because America's a joke these days in the eyes of the world. So let me know where I should flee to, where I can actually have health care for not $1 million that I don't have. Thank you.
This article by NPR reads, health insurers cover fewer drugs and makes them harder to get. Well, yeah, no shit. Health insurance companies are a business. They're traded on the stock market. Their job is to cover the least amount of medications possible while charging you the most amount of money for your monthly premiums in hopes that you don't drop their coverage. They will fight you for as long as they can to deny you coverage of the medication that actually works, the medication that doesn't cause side effects because it's cheaper. Their job is to make money off of you. Do not trust your insurance company. Have your doctor complete the prior authorizations for your medication, write letters of medical necessity, or do whatever it takes to get that medication covered. You know what works for you, not the insurance companies. Your provider knows what works for you, not the insurance companies. Don't let the insurance companies dictate your care.
Do you want to know how bad healthcare is in America? Here's how bad it is.
Yeah.
I get stitches, cut my finger the other day. Go into the hospital, get my stitches done. No big deal, whatever. I have to wait 2 weeks to get them taken out. In the meantime, I get billed for my visit.
Of course.
Before insurance, for 5 stitches, $3,800.
What?
After insurance, $1,800.
Oh, come on.
Or $1,900, excuse me. After insurance, $1,900 for 5 stitches for a terrible hospital visit. Anyway, fast forward, so I get my bill and it's time to take the stitches out, so I schedule an appointment at the urgent care that is associated with the hospital that I went to, same company. So I schedule suture removal appointment online, and then I go in for the appointment and they say, sorry, we're not going to take those out. Since you got them done at the hospital, you have to get them removed at the hospital.
Oh, come on.
I said, why didn't you tell me that when I scheduled the appointment online? They said, sorry, go to the hospital. So I go to the hospital. And then I wait around for a while in the ER, and then I get back and I ask the nurse, hey, this is what happened. They turned me away at urgent care, told me to come here, that you guys would do it for free. Is that true? And the nurse said, let me check on that. I'm going to check with billing really fast. So they go check on billing. And then they say, sorry, billing says that you'll have to pay to get these stitches removed. And I said, that really sucks because I paid $1,800 to have that done after insurance. And they said, that is absolutely ridiculous. I know.
It is.
And then I said, gonna be honest, I'm not gonna pay any more money to the hospital because I already paid too much anyway. So I'm just gonna go. And I said, I think I might just remove them myself. And they said, that makes sense because that was so much money. So we'll just take you off triage. It'll be like you're never here. Don't worry about it. And then they were like, you know what? Don't tell anybody we gave you this. And they gave me a little kit to remove my stitches myself. So that's a little story about healthcare in America. $1,800 will get you 5 stitches, and then nurses have to go behind the backs of the hospital to get you treated. So that's pretty stupid.
It's really sad to think that there are people out there, especially older people, who are really sick and they don't have much. But every time they would need to get checked up or buy medication, it's so expensive for them. Like, they're already old, they're already sick, they can barely move, and they're still getting financially destroyed by these health insurance. It's not fair, I just think that our society, our world needs to prioritize health system better, because health is the #1 thing in the world. If we're not in good health, then we can't do a lot of things in life, you know? And it's just sad how money and just corruption takes over health system. Like, people just really want to prioritize their business. They care more about their money instead of helping people, instead of actually helping the community and just the society. I believe that if everybody is healthy, everybody's well taken care of, I believe that our community will grow much better, but you know, those people on top, the masterminds, they don't want that. They only care about themselves. They're just selfish people who just want to pocket everything. They just want to take all your money just so they can have yachts and everything and just care about themselves, you know? Everything's money nowadays, and that's what's sad.
Hi, good morning, happy Thursday. I just came here this morning to complain about my insurance, and let me tell you why. I'm gonna go through this very quickly if I can. Back in July, I went to the emergency room. I went to a standalone emergency room that was not attached to a hospital because I didn't know that I was going to need to go to the hospital. Didn't know what was going on, having severe pain. Anyways, it turned out that I had an ovarian torsion, which basically means that your ovary has twisted, and that you basically, your ovary gone is done. They can try to fix it, but I already don't have a uterus, so what's the point? Okay, so they're like, we have to have surgery, there's no blood flow, blah blah blah, so I have to go to a hospital. So my OB is at one hospital. This emergency room is affiliated with another hospital, which is farther away, and I was like, I want to go where my OB is. This is where I'm comfortable. They've done all my surgeries, like whatever. They're like, okay, well, we're gonna have to send you by ambulance. I'm like, all right, I guess. I'm like, why can't I just get in my car and go? And they're like, well, if you do, you're gonna have to go through the emergency room, and it's gonna take a lot of time. So that's not gonna work for me because I am in like excruciating pain. So anyway, get picked up by ambulance. They take me to over there, whatever. So I got a bill from the ambulance. They didn't run my insurance or something. Now it's been ran through my insurance. This has been, 6 months now? So they said they're not covering the ambulance ride because it's out of network. How do you have an ambulance out of network? How does that even work? Are you supposed to call, like, if you're in an emergency, okay? And let's just say, hypothetically, like, not my situation, but even a different one. Like, you're having a heart attack. And are you supposed to call and be like, hey, I need to check to see first if this ambulance is a network for me? Don't send one unless it's a network. Like, what is that? How is an ambulance in or out of network for insurance? I freaking hate insurance, man. It's such a joke. It's such a freaking joke.
We haven't had insurance in 10 years, and 2 years ago I broke my foot. And obviously I was like very concerned about what that would look like, because when you don't have insurance, the last thing you need to do is end up in an emergency room. But what I did when I first moved to this area was I called around all the emergency rooms and urgent cares to find out what their caps were. So I asked them, like, hey, do you have a cap on services? What's the minimum that your services start at? So because I did that, I knew which emergency room to go to. So I went to that emergency room. I had x-rays done. I got IV fluids. I got pain medication. I got x-rays, which I think I already said that. And I got a full blood panel. And I was there probably about 4.5 hours. Do you know what my bill was when I left that hospital room? Because they have a cap. $630. I did not get a secondary bill at my house because I don't have insurance. I paid cash. And I walked out of there with a $630 bill for an emergency room. Then I was referred from them to a specialist who was going to cast my foot. And I was casted, so I saw the specialist. I went back in to be casted. I broke my cast and had it recasted. And then I had my final visit with him where he removed the cast. So in total, everything that I paid, including the emergency room, was $1,500. I paid $1,500 for a broken foot with x-rays, a specialist, being seen 2 more times at that specialist, plus having it removed. I paid in total $1,500. I think it was like $1,530 something. And I never got a bill again from anybody. And that was also medications.
Don't feel pressured into getting insurance. I cannot even begin to explain to you how much easier it is to navigate without insurance. Now, I do have kids. We found a primary care physician for my children. They charge $100 a visit for everything. $100 a visit. Insurance is a scam. I also highly suggest looking into the cost of paying cash versus paying through your insurance, because that alone will shock you and will make you want to get rid of your insurance altogether. If you have not already done that, just know that the insurance cost is always going to be significantly more expensive than if you're paying out of pocket. And that alone should scare you.
Just cancel your health insurance. That's the answer. I've had the best health insurance for so many years. Since it's open enrollment, it is showing that I have to pay over $2,000 a month on health insurance. So I decided to actually do my homework for the first time, because everyone has this scare like, I need health insurance. And so I called the clinic where I have to do 4 scans every single year, and I wanted to know, what do you charge me cash if I had no insurance? This year I just went like 2 months ago, and the total cost was $465 that I had to pay out of pocket. I'm like, okay, maybe this is like a $15,000 service and I'm only getting it for $465. That's amazing. Want to know what it would cost with no insurance? The total is $550. Literally less than $100 difference. Meanwhile, I've been paying like $1,500 a month on health insurance. Just now it's going up to $2,000 because it's open enrollment. I called all my other doctors to see, do you take patients that don't have health insurance? They're like, yeah, of course. Some of them didn't want to give me their pricing until I said I might lose my health insurance, and they had no option. I called primaries, gynecologists, pediatricians, eye doctors, the whole nine. Every single one of them, less than about $150 per visit. Health insurance is a scam. Get rid of it.
So I'm turning 26 this year, and I have decided to go without health insurance, and this is a list of reasons why. So first, and maybe most obvious, is that it is expensive AF. I only go to the doctor once a year, if even that often, and I would have had to pay almost $4,000 a year just to have the insurance. And then I just did a whole series on my page showing the cash versus insurance prices for when you do go in to get certain services and procedures. And almost always, a doctor's appointment is double the cost of what you would be paying in cash if you were to pay with your insurance. So for me, I just don't use enough healthcare to justify spending that much money. And in a similar vein, the second thing is that you really can't plan your healthcare expenses if you're just using health insurance. Yes, I know how much I'm paying a month, but when I actually go into the doctor, I really won't know what it is I'm going to be paying for until after I've already had the visit or gotten the procedure or the services that I'm looking for. And then I have no choice but to pay for that amount anyway. That's ridiculous. I'd much rather do something where I know exactly what I'm going to be paying before I go in. And third, what is even really covered by insurance these days? I hear story after story of people who were denied coverage because it was deemed medically unnecessary, whatever that means. It seems like a lot of people think things are covered when they really aren't, and I just would much rather know that I'm going to go in and get exactly what I need and know what I'm going to pay for it up front. Alright, and fourth is that you're limited to what your employer offers you. My employer only gave me 2 options for health insurance plans I could have picked from. I'm sure there's more than 2 insurance plans that exist out in the world that might turn out to be better for me than whatever my employer chose. Other than the deductible and the out-of-pocket max, I would really have to go through those plans with a fine-tooth comb to understand what they're offering me, and I'm really probably not going to do that because I only have the 2 options anyway, so what am I going to do if I don't like what the plan offers? In that same vein, what if I get a new job when it comes to my employer-sponsored health insurance? It seems like a big hassle to me to switch jobs and then have to figure out a whole new network, maybe have to switch doctors. Who knows if you're going to be paying more depending on what the plans they offer. Or you keep what your previous employer gave you through COBRA, but then you're paying way more because you no longer have that employer benefit. So I would much rather just do something where I don't have to worry about employer-sponsored health insurance, what's going to be offered to me, what might have to change if I switch jobs, something like that. I want to do something that I can do no matter what I'm doing with my job. And finally, better and more affordable options exist. I'm going to be getting a direct primary care membership, which is a monthly membership fee paid directly to my doctor, and it gives me basically unlimited access to primary care. And then for emergencies, I want to get a health share plan, which don't work for everybody because they're pretty limited when it comes to covering things for pre-existing conditions. However, I don't have any pre-existing conditions, and anything else I might need, the plan I found is pretty comprehensive and would help me with anything that I need. So these are all of the reasons why I'm choosing to be uninsured. If you're curious to learn more about alternatives outside of the health insurance system, and you want to learn more about if they could work for you, make sure to follow my account because I'm sharing my journey, doing these alternatives myself, and just sharing information about them.
Every time I tell somebody that I don't have health insurance, I get this reaction. What do you do? What are you going to do? I go to the doctor if I need to, and I pay out of pocket. It would cost me $1,200 a month out of my paycheck to put my family of 5 on a health insurance plan through my job. And as somebody who's not very sickly and doesn't have a very sickly family, I really just can't imagine giving $1,200 a month to an insurance company who's going to turn around and tell me what they are and are not going to pay for, and then they're still going to make me pay a copay when I go to the doctor's office. And by the way, the copays that y'all pay is pretty much what I pay cash out of pocket when I go. So I have this grand idea that if we all did not sign up for insurance and instead take that money that you would spend to your insurance company every month and put it into a savings account that is strictly just for your medical things, then you get to decide what you pay for medically, and you don't have somebody else telling you who has your money that you paid saying, oh, we're not going to pay for that. We don't think it's necessary. I know that may not be ideal for everybody and everybody's situation, and there are situations where insurance is a good thing and it really does help, especially state-funded insurances for people that are in, tragic situations or need like a lot of long-term care, or families with special needs, children, and I get that. So I know it's not for everybody, but also everybody doesn't necessarily need insurance. In my opinion, I'm fine. And if something bad happens and I get into a car wreck, they're not going to take me up in there and be like, well, I see you got 2 broken legs and you're bleeding from your right lung, but we got to send this one home because she don't have health insurance. Guess what? They're still going to treat me. And then I'm just going to pay, the minimum monthly payment on my bill if I need to do that until I get it paid off. Or, maybe I'll save up what I would pay to my insurance company and I'll pay it towards that hospital bill. I mean, that's what makes the most sense to me. If you really think about it, why would I pay an insurance company $1,200 a month? And then I'm still going to have to go to the hospital and they're going to overcharge my insurance company. But then I'm going to also have to come out of pocket, I don't know, maybe another $1,200 to the hospital. And it's a scam, guys. It just doesn't make any sense to me. And that's how I choose to live my life. Don't judge me for that.
Can somebody help me understand, why does health insurance feel like the biggest scam? It's like, it's expensive to pay it every month, but then you got an expensive deductible on top of what you pay every month. So to me, that part never really added up, because it's like, why am I paying you every month for my insurance, but then still have to pay a deductible? Like, that doesn't make sense. And then it's like, if you need to see a specialist, then you got to wait for the referral from the doctor to see a specialist. And then once the specialist get the referral from the doctor, then your insurance needs to get the referral from the doctor so that they can approve. I'm like, yeah, it's just too many steps. It's just too many steps. And then God forbid you don't have health insurance. One emergency room visit, you bankrupt. So I'm just trying to figure out, like, why is the healthcare system so complicated? Why does it feel like a scam? And why is it so overpriced? It's like, it costs to live and it costs to die. And I'm in a rock and a hard place right now, y'all, because I'm sick as hell.
Can we talk about how insurance is a fucking scam? So I just left the doctor. I was supposed to go for an iron infusion because I'm severely anemic. My appointment was 1:45. It is now 2:36. Guess what? Didn't get a fucking infusion. Why, you ask? Insurance didn't approve it. That's why. Why didn't insurance approve my iron infusion? I don't know. All of my levels are below normal, okay? I'm anemic. I've always been severely anemic. I had gastric bypass 20 years ago, which caused my severe anemia. My blood tests show that I'm anemic, and the insurance company still denied it. What are we paying insurance companies for? Like, where is my money going and why? I don't understand. Somebody make it make sense. Please explain to me. Where is my money going when I pay into insurance? Okay? Well, rather my wife, because I'm on my wife's insurance. Okay? When we pay, or rather my wife pays every 2 weeks out of her paycheck from her job. Where the fuck is that money going? If the insurance company is going to deny treatment that is needed, okay? Needed. This is not optional. This is not cosmetic. This is not... I have been looking forward to this appointment, okay? No, I'm not looking forward to 3 fucking hours sitting there with an IV in my arm getting an infusion. Absolutely not. But what I am looking forward to is not feeling lightheaded every time I stand up, not craving ice 24/7 because that's all I do is eat ice, not being fucking freezing cold and sitting in front of a heater
all the time with it on blast and having marks on my skin because I literally burn the shit out of my skin because I'm always so fucking cold. And you might ask, well, why don't you just take iron pills, Dana? Well, my body does not absorb them. When you have gastric bypass, your body does not absorb pills for whatever reason. Don't know why, don't really care, whatever. I'm not sure, don't know. Doctor explained it one time, I forgot. All I know is I need an infusion, okay? An infusion, one time, lasts for 3 hours, lasts me a good 6 months to a year. And the insurance had the fucking audacity to deny it. Deny. Like, deny. Meaning, no, Dana, you cannot have a fucking infusion. What? How are you going to deny it when it's something that I need? My levels are clearly, like, this is not, what? Seriously. We need to get on some shit that, like, the other countries have where it's free healthcare and, you know, whatever state regulated healthcare, because this is bullshit, okay? I know there's people out there that get treatment denied every single day, and it's bullshit because this is medical. This is absolutely treatment that is warranted. This is not lip injections. This is not shit that, you know, cosmetic that I want, that, you know, I'm asking somebody to go pay for because it's something I want. This is something I need. This is something that is hindering my everyday fucking life. I'm fucking livid. And I don't understand it. And I
This is how you know we're fucked as a society. I try using my insurance for the first time after about 7 months of employment, okay? First time I've had insurance through an employer in many, many years, okay? Not on Medicaid. At this point, I'd rather go back. Tell me why. I try and schedule my first appointment with my insurance, and I'm getting the runaround back and forth between insurance provider and the doctor's office of how much this appointment's going to cost me, okay? I pay roughly $80 each paycheck for my insurance, okay? Decent amount for good insurance, okay? My percentages are about 90-10 if it's in network, okay? This doctor's in network. Tell me why I found out that I have to pay roughly $4,000 of my deductible before insurance starts covering anything. That doesn't make sense to me, okay? But this is all brand new to me, okay? I call the doctor's office, mental health for my son, because we've been going through some shit. And I find out that out of pocket, it's going to cost roughly $400 for this appointment. And they couldn't tell me how much I'm going to pay for this appointment until after I attend this appointment. Make that make sense. So we have a mental health crisis in this country because people have to choose between buying groceries that have gotten way out of hand and mental health services or healthcare in general. That doesn't make fucking sense to me. And we wonder why America has so many issues going on right now. Healthcare is a #1 pyramid scheme. At this point, I'm convinced. Sorry. Frustrated rant.
I really believe that health is our wealth. And for us, I believe that the primary treatment, the primary health insurance that we should have is exercise, daily exercise. We need to be investing in ourselves more than anything. Because if our health is not 100%, we can't do things. We can't work. How are we going to make money if we're not healthy? You know, so #1 is our health. We need to prioritize our health. Because if you're sick, you can't do anything. When you can't do anything, you can't make money. You can't make money, you're gonna die. You don't have any food to eat. So invest in yourself by working out daily. Daily exercise will definitely be the #1 medication I would recommend. I'm not a doctor, but like daily exercise will definitely help all of us.